Welcome to Conversations in Tinnitus, a video podcast of the American Tinnitus Association. The American Tinnitus Association is a public charity under Section 501c3 of the Internal Revenue Code, a charity dedicated to research, advocacy, education, and support for people living with tinnitus, including their families. Conversations in Tinnitus video podcasts reflect our mission to amplify the patient voice, showcase evidence-based and promising emerging treatments, and highlight cutting-edge research. All of this is made possible through your generous support. Thank you. Hello, and welcome to another conversation about tinnitus. My name is Patrick Lynch. I'm the CEO for the American Tinnitus Association, or the ATA. Today, in this conversation, we're going to be discussing an important and often misunderstood aspect of tinnitus, the fact that tinnitus exists on a spectrum. For some folks, tinnitus may just be a mild annoyance, but for many others, it can be life-altering, going so far as to disrupt sleep, concentration, the ability to work, and even the will to keep going. However, it is vital for the ATA and all stakeholders to emphasize that the majority of tinnitus cases do not fall into this category that we refer to as severe, nor do all tinnitus cases eventually become severe. Today, we will be discussing the category of severe tinnitus. If your tinnitus is new to you, or if you're struggling with it, we highly recommend that you first explore the American Tinnitus Association's other conversations from this Tinnitus Awareness Week, as well as other resources on the ata.org website that will provide foundational information about tinnitus itself and practical steps for managing and seeking help for tinnitus. Additionally, if you are experiencing thoughts of suicide, as always, please make sure that you call 911 or 988 immediately. For guidance on managing your tinnitus in general, the ATA is always here to help. You can call our toll-free helpline at 1-800-634-8978. And without further ado, we just want to also mention that for everybody listening today, while severe tinnitus is not the norm, it is a reality for a significant number of people. And for these people, it's important that we all understand that they deserve our empathy, our compassion, and our meaningful support, whether you're a loved one or a provider. Tinnitus, especially without a cure, requires constructive approaches to help people manage and reclaim their lives. Cognitive behavioral therapy, sometimes referred to as CBT, stands out as the strongest evidence-based tool proven to reduce tinnitus-related distress. And that leads to our guest today. We are absolutely honored to have with us one of the leading experts in this area, Dr. Bruce Hubbard. Dr. Hubbard experienced his own version of severe tinnitus over 20 years ago, which since has profoundly shaped his life and his career. After turning to CBT for help, he not only recovered, but he's also made it his personal mission to support others that are navigating tinnitus distress. Bruce, Dr. Hubbard is the founder of CBT for Tinnitus, LLC. He's published extensively on CBT, mindfulness, and tinnitus, and his webinar, Cognitive Behavioral Therapy for Tinnitus, which is sponsored by the Anxiety and Depression Association of America, has been viewed over 400,000 times. Dr. Hubbard's also a visiting scholar at Columbia University's Teachers College, a past president of the New York City Cognitive Behavioral Therapy Association, and most proudly, he's a member of the ATA's Scientific Advisory Committee, and we thank him for his service there. Dr. Hubbard, I want to thank you for joining us here today to share your insights, your expertise, your personal journey, and to really help us all understand what CBT is and how it can help all of us living with tinnitus, especially those with severe tinnitus, to find both hope and relief. Welcome.
Thank you, Patrick. The honor is mine. The ATA has just continues to do a tremendous job of providing information to people to help them get the resources that they need and to help calm down and understand how to recover from the awful distress that can accompany tinnitus. So it's just an honor for me to be here.
Well, thank you for your service. Thank you for the kind words about the ATA. As you know, we've been around for over 53 years now, founded by Jack Vernon, one of the original researchers of tinnitus, and our ongoing mission remains to together with all of the stakeholders ultimately silence tinnitus. And so we're very proud of the work we've done and look to do in the future. So thank you for being a huge part of that as a member of our scientific advisory committee. And I think, Bruce, both for myself and for our audience, you have such a powerful story, and it really starts with your personal experience. Maybe we could start today with you sharing a bit about your own journey with tinnitus or tinnitus, and whether I should be saying tinnitus or tinnitus myself would be a good place to start. But also, how did your personal experience shape your approach to helping others in this field?
Well, 20 years ago, with no specific precipitating cause, there was no loud noise event, no ear infection. I was just sitting quietly in my New York City apartment one evening, and a very loud sound started in my right ear, and it has not stopped since then. So at first, I hoped that, as many people do when tinnitus first starts, I hoped that there would be some treatment for it, some resolution to the sound itself. I had put tremendous hope in my doctors, and by the time I had seen the my primary care doctor and my second ear, nose, and throat doctor, the second one, who was at that time the top tinnitus doctor in New York City, who told me, well, and this is the typical story, it probably won't go away, and there's no treatment, but you'll get used to it. My anxiety just went through the roof. And, as I often tell my patients, if someone wanted to find a way to torture me, they would put an uncontrollable sound in my head, that was with me in all intimate spaces of my life. So it really did send me into a profound downward spiral. I had two young children at the time. We had just taken out our first mortgage on a New York City apartment. I had just expanded my psychology practice significantly. So I could not stop pedaling. I had to keep moving. But I was like a zombie for 6 months going through my life. I did all the things that the standard advice tells us to do. I restricted my diet. I completely stopped using alcohol and caffeine. I reduced salt. I reduced my stress level. And over that first 6 months, and this does sometimes happen, I know now, my tinnitus actually got a little worse, which just really stimulated my own catastrophizing, which we'll talk about, jumping to the worst case conclusion that my tinnitus is just going to continue to get worse and worse, and eventually I'll be living in a world of tinnitus and won't be able to hear anything else. And that level of worst case scenario just really drives people's anxiety when tinnitus first starts. And that was the process I went through. I found myself avoiding a lot in my life. Aside from just the aspects of my diet that had become part of my lifestyle, I was avoiding quiet spaces where I would hear my tinnitus. I was avoiding loud spaces that I irrationally thought would damage my hearing further and make it worse. So it just had a profound impact on my life. And like many people who I work with, honestly, I've been through some tough things in my life prior to that. That was the worst. This little
No
sound
kidding.
in my head, had the most profound negative impact of me. I was 45 at the time, by the way. So, I'd already done a lot of living like many people. I know now that's a very common age for tinnitus to start. Um,
It's
So,
fascinating
yeah,
for you to mention that, Dr. Hubbard, if you don't mind my interrupting real quickly,
please.
because you touched on a couple things. I experienced tinnitus myself. I've experienced it since I was about 18 years old during chemotherapy treatment I had as a teenager. And while I fall into that, we spoke earlier in this conversation about the spectrum of people who experience tinnitus. I probably fall into the end of the spectrum where it's not quote unquote bothersome, and certainly not severe. But I have experienced it for a long period of time, and um, you touched on the fact that there were things you already were able to identify in your personal life that made it worse or that you wanted to avoid. And you mentioned sitting in a quiet room, which I experienced to this day. If I'm around too much quiet, it's when I really start to notice my tinnitus. And I know we'll touch on a lot of these ideas in a little bit. Um, but you said something earlier that was also really interesting, which was uh, that panic spiral, that not necessarily knowing what to do or where to go next, or whether it was, I would imagine you were having conversations with yourself about whether it was really as bad as you thought it was. Um, One of the questions that we wanted to chat about with you is the idea that people might experience a sense of shame or failure because they've been struggling with it, and myself included, and maybe struggle with finding the right answer or finding something that works for them. How would you? I don't know if this is a great place to go next, but um, I know behavioral health is a big part of what you do and what you found to help for yourself. If someone were experiencing shame or failure at this point in their journey, what would you recommend would be a good way to handle that kind of an emotion, but B, maybe what to do next?
Well, to just to reassure people first quickly, I went on and fully recovered from that distress. While my tinnitus has not changed at all, it's the same loud, obnoxious sound that had me on my knees that first 6 months. Once I understood what to do, and we'll talk about that. I started feeling better right away. My functioning started to resume. I could sleep again. I could concentrate again. And gradually I started feeling like myself again. So I do want to reassure people that despite that awful experience I went through, I was able to fully recover, to fully habituate. And my tinnitus has not been an issue for me at all for the last probably 18 years. Um, but yes, to get to your question, Patrick, which is an excellent question, because I felt very ashamed of what had happened to me. And this is true for many people as well, I attribute my tinnitus to my careless exposure to loud music that I had experienced joyfully as a young man. I played classical piano for many years, which is a very loud instrument. I played in rock and roll bands on and off for 20 years, and I never used hearing protection. No one did at that time. So I'm confident that that's what led to my tinnitus being as loud as it is and as busy as it is, though that's not always the case. And there are various causes for tinnitus. I don't mean to pin it on that. That is a very common one. So I was really kicking myself. I felt very guilty and ashamed that I had brought the problem on myself through my careless behavior. And so I had to go through a process of forgiving myself in order to get to the point where I could do the work I had to do of accepting the fact that this had happened, and getting it past me and moving on in my life again. Now, many people do feel some shame that prevents them from getting the services that they need, and there's we'll see about I estimate, and I may be estimating up a little bit, about 250,000 people in the world who are stressed by tinnitus. That's a lot of folks. Now, as Patrick mentioned, the stress varies from mild to severe, and it doesn't necessarily reflect the nature of the tinnitus itself, the sound that we're hearing. But it is a very common problem to develop tinnitus distress, and there are absolutely ways that we can access to address it and to calm down and get our lives back, as I eventually found.
Your story's so inspiring, Dr. Hubbard, and I've experienced this in my own life. I have a personal health journey that I've gone through that has since shaped my own career, professionally as well as my personal life. And you've spoken publicly so many times about integration of certain experiences into your day-to-day living, and obviously that's a part of the tenet to something like CBT or cognitive behavioral therapy, is sort of integration of things into your life. For those of us who are in the world of tinnitus or tinnitus every single day, there are certain key phrases we hear all the time. We have to be very sensitive and careful about using terms like severe versus bothersome, for example. But you also mentioned another term that, if you're in the world, you hear it right away, which is the idea of tinnitus distress. And we've spoken a couple times already about this idea of the spectrum of tinnitus. So for those folks who, maybe you could help us understand a little bit what tinnitus distress is considered by definition, and help us understand a little bit better why it is that this is a spectrum. Why is it that some people have bothersome or severe and others don't really notice it?
Great question. Thank you. So, yeah, psychologists do make the distinction between tinnitus, which is the stimulus, and the distress, which is the response. And so it actually turns out, and there's a considerable amount of research on this, that the level of distress we experience resulting from tinnitus is not necessarily associated with the severity of the tinnitus. So that leads to a lot of really important conclusions. One is uh, that tinnitus does not necessarily lead to suffering. That uh, the again, people can have tinnitus and can have loud, busy tinnitus and not suffer from it. And people like me I believe my tinnitus itself, the volume, the busyness of it probably falls into the moderate to high moderate level, though it's very hard to understand what we're each hearing. Uh, and I've been able to fully recover from that and fully habituate. So the factors that influenced me, that led to me being so distressed, were first the cognitive aspect of it, and that's this age old wisdom that how we think about important aspects of our lives, the problems in our lives, how we what we believe about those problems and the effect that they'll have on our futures can have a very strong effect on how we feel and behave. That's one of the principles of cognitive behavior therapy. And the perspective that I was locked into for those first 6 months that caused so much distress was what I now call the control perspective. And that's the belief that to have tinnitus is to suffer, that unless I could get control over the volume of my tinnitus, bring the volume down, if not make it go away entirely, I would continue to suffer for life. And that's just not true, as I ultimately discovered. So and the other, couple of other aspects, the avoidance, the impact that all that avoidance had on my lifestyle really made tinnitus, the sound I heard, very important and kept me locked into it in a process I call the tinnitus trap, where the more importance I placed on that sound, the more I reinforced my alarm brain, which is the defensive component of the limbic system, the part of the brain that reacts to perceived threats, just reinforced my alarm brain interpreting tinnitus as a threat and continuing to trigger all of that anxiety and hypervigilance to tinnitus. So ultimately, I found, and this is another key component of cognitive behavior therapy, that approaching those areas gradually, a little bit at a time, really allowed my alarm brain the opportunities to learn that, okay, this is not pleasant having this sound, but in fact, it's not dangerous. It's not a threat to my lifestyle. I knew it wasn't a threat to me medically, but it was not a threat to my lifestyle, that I could get better at coexisting with
Mm.
the sound in my head and listening past it to engage fully in all the important areas of my life.
You, thank you. You keep touching on where I think we're headed next with some of these questions we wanted to chat about with you, and I think the next place I want to take the conversation really is we've talked about acceptance, daily living in our lives here. Um, so the question that we have pre-populated here is the importance of acceptance and managing a chronic tinnitus, and the strategies. But I think maybe it would be helpful for some of the audience if before we even speak about the importance of acceptance, you help us understand, if you could, what cognitive behavioral therapy is. We hear this term a lot, in if you Google tinnitus, you'll see CBT quite a bit. Obviously, it's in the title of your LLC, but maybe you could very quickly help us understand what CBT is, and then that could lead us into the importance of accepting and managing chronic tinnitus.
Sure, absolutely. So,
Thanks.
cognitive behavior therapy is a form of psychotherapy or behavioral health treatment. It's been around for many decades and it's gone through considerable development. So, at the time CBT for tinnitus was first developed in the 1990s, the emphasis was on changing our thinking. And I did just refer to that, and that's an important step in using cognitive behavior therapy to help folks like me with tinnitus. Interestingly, what got left out over time was this idea of accepting the tinnitus. So the first CBT for tinnitus program that was introduced in the late 1980s, acceptance was a key component. This was Dr. Richard Hallam, a psychologist in the United Kingdom, was very clear that accepting tinnitus, not fighting it and resisting it, was the first step toward promoting recovery and habituation. So, by acceptance, we don't mean approving of tinnitus or embracing tinnitus. If tinnitus were running for election, we wouldn't be voting for tinnitus. We don't mean acceptance in that manner. What we mean is making really a practical decision to stop fighting, resisting, and struggling with tinnitus, to acknowledge that it's a fact of our lives, and to instead put our attention and energy into accommodating to it, as I said earlier, coexisting with it and getting past it to get back into our lives. Now, cognitive behavior therapy went on to evolve into a family of really of cognitive behavior therapies. And one of the most important members of this family of CBT is acceptance and commitment therapy. And the founder of acceptance and commitment therapy, who has published in the ATA magazine Tinnitus Today, Stephen Hayes, has tinnitus. As he writes about his experience in Tinnitus Today, he was a key uh, factor in my learning how to do mindfulness correctly when I was struggling with my tinnitus. Steve gave me some tips over a professional listserv that really set me on the right track and helped me tremendously. So, acceptance and commitment therapy, sort of the newest form of cognitive behavior therapy, right in its title, as it says, the goal is to be clear about what we can and can't get control over in our lives as problems arise, and to be able to accept. And again, that's just that practical decision to, hey, I can't get control over this, so let me stop struggling and fighting with it, and to allow it to exist, and instead to commit to taking regular action to fully engage and the behaviors in our lives that will get us where we want to be. So with tinnitus, for me, that was getting back into those social settings, joining my family fully again, listening to music again, which was a really important part of my life that I stopped for probably a year, thinking that, that it would just make my tinnitus worse. And by the way, I've gone on and had some of the most passionate music experiences of my life since my tinnitus started. So
That's hopeful to
ultimately,
hear.
it was no barrier at all. Just plug your ears up appropriately. You have to use proper ear protection.
That's a really great point, and a topic of one of our other conversations for Tinnitus Awareness Week is the idea of prevention, and really looking at your hearing as part of your overall healthcare, right? And
Great.
just like
Yeah.
you wouldn't eat McDonald's every day for
Yes.
your GI system, you certainly wouldn't
Right.
go to a loud concert every day without earplugs. And at some point, we all need to start thinking about hearing healthcare protection.
Good.
Um, you mentioned something in your answer there, which I think folks who are on this spectrum of bothersome or severe, and you experienced it in your own journey, which you just shared, which is this sense of isolation and removal from your loved ones and your family and friends. Uh, Maybe you could speak a little bit about that and what advice you might give to someone who's currently experiencing that sense of isolation.
It's really tough because no one else can hear our tinnitus. That's one of the most frustrating aspects of this problem. It's what in the health sciences we call an invisible injury or an invisible disability. It's impacting us greatly, but nobody else can hear it. So they really don't fully understand what we're going through. And I often say if we could, for some of our family members who aren't more empathic and responding to our plight, if we could just take the sound of our tinnitus, put it out in the environment, and have that follow them around for a few weeks or months, I think they'd have a better idea about what we're dealing with. Um, but no, it's to really try to not complain about it to your family members, and instead really view them as a significant resource. And we want to be very careful to protect our resources. So, really try not to complain to family members. Instead, try to recruit them. It is really important to share what's happening. I really tried to share with my wife, who I was a very, very important part of my life, and my co-parent, for our two children. So she understood what I was going through. She provided encouragement for me. It's very hard for loved ones when they see their partner suffering, or their child, or their parent, or brother, sister, or friend, and they feel like their hands are tied, that they don't know what to do. So there is actually a lot that the loved one with tinnitus can do. And I'm just going to say, reach out to the ATA, go to the ATA website, and that's just a quick way to get information. If you're interested in cognitive behavior therapy, please go to my website. There's a lot of free resources there to get people started and educate them about what they can do.
That's a really great point. Empathy is so important in any version of storytelling, whether you're a Hollywood director, or a public charity trying to raise funds, or a business person trying to get new business. It's about uh, getting folks to resonate with whatever your story is, and so that's a two-way street, right? So it's on us
Yeah.
to understand our
Yes.
audience as the patient, and
Mhm.
then certainly if you have the if you're a provider or a loved one of someone going through something like this, it's trying to channel that empathy and find ways to listen and connect with what someone might be experiencing. And then obviously, among many resources, I just want to remind folks, if you are at the severe end of this spectrum, or if you're having very dark thoughts of self-harm, always, of course, please, in addition to looking at resources like the ATA, consider 911 if you need immediate help. In the word, or in the definition, cognitive behavioral therapy, CBT, is the word behavior. And right after that, you start hearing terms or Googling terms. You see things like behavioral health professional, seeking out a behavioral health professional. And I think oftentimes there can be a stigma associated with some of those words, especially for certain generations. Maybe you could speak a little bit about that. Do you think there is still a stigma? And if so, um, how would one tackle that stigma if they felt that?
I, yeah, I'm afraid there is, particularly for men. It's very hard for men to feel like they don't have sufficient control over a problem like this in their lives and to reach out for help. So I want to really assure people out there that the type of treatment that I provide and that cognitive behavior therapists, behavioral health professionals provide is very practical. It's we're not going to have you lie down on a couch and talk about your childhood. It's really focused on helping people identify concrete issues that they're struggling with in the present moment. And we teach people concepts and strategies to help them address those issues. A lot of it is just age old wisdom that has been distilled into this program we call cognitive behavior therapy, acceptance and commitment therapy. I really liken it to physical therapy for the brain,
Mm.
a set of practical concepts and exercises to help us achieve a specific goal of overcoming a
It's
problem
a
like
great,
tinnitus.
great analogy. Physical therapy for the brain. I'm personally going through physical therapy right now. I had an injury to my ankle, and
Sorry.
I thought the surgery to fix the broken bone was like the finish line, and lo and behold, it's just the start
Yeah,
line. It's all the
often.
physical
Yeah,
therapy I have to do after the surgery that is still going on right now.
yeah,
It's a
well
great
said.
analogy. Um, eh, Maybe you could help us understand a little bit better. So we've talked about behavioral therapy, the idea of CBT. Um, if someone wanted to access some effective version of CBT as it relates to tinnitus in particular, what would you recommend to that person? Where would they access something like that?
It's another great question because, as you had pointed out at the start, Patrick, cognitive behavior therapy really is the most evidence based, clinically proven treatment to help people with the distress associated with tinnitus. And yet, it's what in my field is called, or in medicine in general, a research to practice gap, where there's a very research has identified a effective treatment, but the typical doctor's office does not provide that treatment. Excuse me.
No, not at all. And this was actually in one of our other questions is and it's part of our mission at the ATA, right? Is helping to identify providers who are have some semblance of a background and or certification or a specialty in this world of tinnitus.
Hmm.
I would imagine that applies to CBT as well, right? Trying to find a
Yeah,
behavioral
yeah.
therapist who is familiar with some of these terms and
Yeah, it is it there are it's getting easier and easier to find a qualified cognitive behavior therapist or acceptance and commitment therapist. They're very much in demand because it's such a practical form of therapy for a lot of common problems of all involving emotion. But in the tinnitus world, again, it can be hard to find. So this has led to unqualified professionals trying to fill the gap. And I
Hmm.
want to believe their hearts are in the right place, but they're just not the right professional, the qualified. So we get into what's called a scope of practice problem, where a given, by scope of practice, what we mean is that a health profession, and in this particular case, it's tends to be audiologists, are qualified and licensed to provide a certain set of services pertaining to hearing loss, largely. And they don't have any training or qualifications to provide psychological treatment or psychotherapy or to diagnose the kinds of conditions that often surround tinnitus distress, like anxiety, depression, and insomnia. So it really has become a problem as they're attempting to fill the gap. So I really do encourage people to be aware of that and don't expect to be getting cognitive behavior therapy from an audiologist. There are more and more qualified cognitive behavior therapists and acceptance and commitment therapists who are learning about tinnitus, recognizing that there's a need and providing this treatment. So I had thought about compiling a list of names, and I'm not sure this is the place to put that up on the screen, but people can certainly reach out to me through my website if they're looking for a local person, and I can let them know if there's anyone in that area who I'm aware of.
Thank you, doctor. We'll absolutely share that information as you share it with us, and we appreciate that. And obviously, if someone's made it this far into this conversation, uh, they're very interested in some of this information. And I'll just share, since it's coming up, this is part of the founding mission of the ATA, which it goes all the way back to 1971, which is pre-Google, it's pre-internet. Which was basically two gentlemen who were in the field as a patient and a researcher, trying to share information, reliable information, and that continues to be a struggle today for folks, whether it's finding a provider or just figuring out whether a certain treatment works or doesn't work, and what's which craft and what isn't. I'd like to share in this recording, as the CEO for the American Tinnitus Association, it is part of our immediate roadmap to try and improve that situation. So we are uniquely positioned as a nonprofit, as a public charity, to be a neutral platform for reliable information. And so we're hoping to drastically increase where we can, not only referrals and resources in your own zip code or backyard, but also training for professionals where we can. And so I would say to folks, if you made it this far into this conversation and you're either a provider or a patient, stay tuned, because the ATA, it's been part of our mission for over 50 years, but we have some things in the pipeline that are coming very soon that will continue to address this problem. And I think the need is great. So it's going to take a while for all of us to tackle it, but where the ATA can, it wants to try and answer some of those questions. How do I get certified? How do I learn more if I'm an audiologist? If I'm a patient, where can I find folks who know what they're talking about and what's real and what isn't? You mentioned, doctor, we've talked so much about CBT. It's obviously your specialty, and it's been a part of your life professionally and personally for such a long time. I hope you don't take offense to this next question. I'm trying to ask it as authentically as possible, because I've thought it myself over the last 25 years of my own tinnitus journey. And I've spoken with folks who continue to experience it, which is, come on, that can't be it. There's got to be something else. You're telling me there's nothing else I can do. All I have to do is go to a behavioral therapist. There's nothing else, or for someone who's thinking to themselves, that's got to be hogwash. There's no pill I can take. There's no machine I can buy. It's just go talk to a behavioral therapist. This sort of touches on that stigma issue we were talking about earlier. How would you address someone who's thinking that way?
Well, unfortunately, there really is no pill or machine at this point. So the next best thing is what we call habituation, tinnitus habituation. This is widely understood in the field. There are audiology treatment programs that are designed to promote habituation, tinnitus retraining therapy being the most prominent. And habituation really is, I'm dare I say, at its highest level, essentially a cure, and I'll put that in quotes, for tinnitus. So I have fully habituated to my tinnitus. And by that, we mean that the tinnitus hasn't changed at all, but my alarm brain, again, that part of my limbic system, that part of the brain has learned that the tinnitus is not important and has reduced its automatic reaction. So all of that anxiety and annoyance I once felt, all of that, what I call hypervigilance, that excessive monitoring of tinnitus, judging what's it doing, is it getting better, is it getting worse, all of that just gradually subsides over the course of habituation. So any good tinnitus program that is designed to help people in the absence of a legitimate cure to actually stop the sounds should really be focused on helping people habituate it. I can attest to it. It is a tremendous place to be. My tinnitus means nothing to me at this point. I can honestly say,
That's amazing.
again, it hasn't changed. It's still there. I can hear it. And I do hear it from time to time, but it's just not an issue. So, CBT and acceptance commitment therapy, when done correctly, that is the goal. And even a little bit's important. It's not all or none. It's like losing weight or getting in shape in the gym. Just a little bit of improvement can make a vast difference in your experience and your lifestyle. So just a little bit of tinnitus habituation can help get it out of the center screen, put it in the background, right? And even at times it'll go off screen, and that really is the seems to be the most common outcome for most people with tinnitus. And that's my mission in life, is to try to promote that
Beautiful.
for as many
It's
people as
really, really
possible.
beautiful. And thank you. And I didn't mean to. I hope I didn't ask that question too harshly. I'm trying to empathize with our audience here. I've been on board as in my role serving as the CEO for the ATA for only around 6 months now. And although I've been journeying through tinnitus for over 20 years, uh, one of the terms I've been hearing more and more often uh, has been evidence based. So as we're talking about different therapies and providers and professionals to look toward, um, the importance of treatments and products and folks who are practicing things that are evidence based. And we know, and we spoke at the top of this conversation, that CBT happens to stand out as the strongest evidence based tool proven to reduce tinnitus related distress. Can you speak a little bit about that? Like, how is it that CBT came to be so heavily studied and proven out over time?
Well, cognitive behavior therapy is based on clinical science. It's based on psychological science, and as part of that science, the a significant process is excuse me, my screen keeps shifting here, and it's I have to keep putting it back in place. Some automatic process
The
with
joy of
the
technology in
software, I guess.
2025. You're fine.
Yeah, not used to it. But yeah, it's really based on psychological science. And part of that process is doing what's called controlled research. So, controlled research means that you have an experimental group and a therapy group, and you're putting your ideas to the test. If you believe that whatever your treatment for tinnitus is, that this is going to help and it's going to be better than the other treatments out there. And there are massive, massive number of examples of this. Um, then, cognitive behavior therapists are very dedicated to being accountable by testing out their assumptions about the effectiveness of their treatments. So there have been well over a dozen carefully controlled studies of cognitive behavior therapy. It doesn't mean, I'm the first to admit it, that it's better than other strategies out there necessarily, because in order to determine that, you'd have to directly compare it to the other strategies. But it is, again, the most clinically proven. Of those dozen studies, every single one has found that cognitive behavior therapy or some variant of cognitive behavior therapy, like acceptance and commitment therapy, has significantly reduced the distress due to tinnitus. So that's what we mean when we say that. And it's not just cognitive behavior therapy, it really is the evidence based movement is really a strong force in the health sciences in general right now. So, if you're undergoing any type of treatment, you want to know that there's been some careful clinical research, science based research on it to show that it's actually effective and to back up its claims of being effective.
Thank you. And I want to try and bring us back a little bit, if we could, to some of the folks who are at this point definitely probably on that spectrum of heavily affected in this conversation, and certainly they can feel overwhelmed at this point. And we spoke a little bit already about communicating with loved ones and doing our best to hope that they have empathy as well. Um, we've spoken about acceptance. We've spoken about empathy. It is, and I feel like we spoke about this a little bit earlier too. Because it's such a long journey. Um, it's peaks and valleys, right? And so someone at some point might feel failure because they've tried the empathy, they've tried seeking out the behavioral therapist, they've tried all the different treatment methods. How do you help patients navigate this type of emotion of feeling failure or shame?
Well, first of all, and I'll just jump out, say, Bryce, there is a slide in there of the rocky road to recovery. If you could find that and show us that slide, that's going to get at what you're referring to, Patrick. Because there really, it really is. It's not that one. It's a graph, a chart. I think it may be.
Is it earlier
That's
there? I
okay.
can try.
That's
Well,
okay.
I'll try and find it
That's okay.
while you're talking.
Yeah, that's okay. But it really is common to have setbacks along the way. It's a routine part of recovery from the distress. I had a setback 8 years in to full habituation. And oh, you're getting close. It's not that one. It's a zigzag. There you go. That's it. The rocky road of recovery. So you can see here that now this is for someone that maybe I'm not sure this is exactly your question, who's really committing to a recovery perspective through a CBT or acceptance and commitment therapy type program. And the point that it's making is that on average, they're going to be getting better. By that, I mean their emotional reaction to tinnitus, the effect of their alarm brain triggering the reaction to tinnitus going to, on average, be going down over the months, but they're going to experience good and bad days with it. And this is very common. It happens all the time. One of the signs that you're advancing in your recovery is that this does not happen as often. And it's much easier to negotiate when it does. You're much less apt to get stuck in one of those spikes there. Um, so that's very, very commonly reported, and I experienced that as well. As I said, even 8 years in, I hit a setback, and was able to negotiate through it. And within a few weeks, I was completely back on track. So there are ways to do it for sure.
That's helpful to hear. I've always found in this journey, uh, and you can speak to this better than I can, but find allowing yourself to recognize the peaks and valleys, to give yourself forgiveness, almost in a sense that it's a journey where you're going to have you may have setbacks, and that's okay. That's a normal part of this process.
I
Um,
think the other, sorry to interrupt, but the
yeah.
other thing I would say is I've really come to distinguish between what's often referred to as tinnitus management and
Mm,
tinnitus recovery. So, tinnitus management implies that tinnitus is going to be a burden for life, like a chronic pain condition. That's often an analogy that's used. That it's something you're going to have to manage with different types of sound therapy, sound enrichment, by watching your diet, by being careful about the kinds of settings you enter into. And I just don't view it that way because again, with habituation, the goal is always to get tinnitus behind you, where you're not going to have to manage it. And just that idea. So again, I don't have to manage my tinnitus. It's nothing to me. And the very process of managing it makes it important and can potentially block and hold back habituations. So that's very much the approach I take. Again, I think any tinnitus habituation approach, and that's tinnitus retraining therapy and ACT and acceptance and commitment therapy. Sorry, that's often the acronym referred to as ACT and CBT. That's the goal. So you really would expect it can be a very gradual and extended process. I don't mean to in any way uh, indicate that within a few days or even a few months you'll be completely out of the woods. It took me a couple of years to fully habituate. Again, I started feeling better, however, very quickly, and tinnitus was much less of an issue. But again, that idea of managing it just kind of makes it important instead of just the idea of getting it behind you and moving on.
Really, really key aspect there, and perspective to have on this whole journey. I think if at this point, doctor, maybe to try and help us wrap it up, if someone's made it this far into the conversation and they aren't themselves experiencing tinnitus or tinnitus, it probably means they're the loved one of someone who is. Um, could you give us a little more advice if I were a friend or a family member of someone that I knew was experiencing tinnitus? What advice would you give me as the loved one for in this scenario?
Well, I would definitely encourage them to learn about cognitive behavior therapy and acceptance and commitment therapy. Again, as we're agreeing, those are the most evidence based, clinically proven solutions to the problem of tinnitus. Um, if you can connect the loved one with me or someone who does this work, or even again, there's a tremendous amount of information on my website. I'm only I keep referring back to that because there's a lot of misinformation about cognitive behavior therapy and tinnitus in general on the internet, and I'm not sure where else to send you. But that can be very reassuring. And then if your loved one again does feel some shame and some stigma about pursuing uh, uh, a, uh, a psychological based treatment, then again, I just will encourage you to present it to them that it's like physical therapy for the brain, and it's nothing
Perfect.
to be ashamed of. And again, the smart thing to do is if you're struggling with a problem, to get the right kind of help.
Well, doctor, thank you. I think that's a great place to end this conversation for now. Certainly, your own personal journey, your professional journey have stayed true to the old cliche: actions speak louder than words. So, thank you for sharing some of your expertise and your empathy in this journey. Again, we want to remind folks who might still be watching. Um, there are resources there for you. Certainly, if you are at a severe end of the spectrum and you're considering thoughts of harm or feel very alone, always call 911 in the case of emergency. But you can always visit CBT for tinnitus online. ATA.org remains a resource. And of course, the ATA has its 800 helpline, 1 800 634 8978. To those of you who are on this journey and are experiencing the severe versions of this affliction, please know we're here for you. And Dr. Hubbard, thank you for your dedication. I don't know if I've missed anything at this point in the conversation, but I look forward to continued conversations with you in the future.
Same here. Thank you
All
very
right.
much.
Thank you so much. Please consider a donation today.